And Avik Roy is back with us from the Manhattan Institute. Let me start with you, ma'am. As I understand it, we thought that the cost of this, when it was first enacted back in, 2003 or 4, was going to be astronomical, but it's actually come in 45% less expensive than CBO thought, and the majority of senior citizens who have it like it as it is, don't mess with it. Is that accurate? And if so, why is the administration going to mess with it?
That is a very accurate description. 90% of the people on Part D like it, are happy with it. As you said, 45% lower than the CBO estimates, even more so than Medicare's agency estimates, which were initially $100 billion higher over a 10-year period. It is an incredibly good question. With all that HHS and the Medicare agency have to do in terms of cleaning up all the problems with the Affordable Care Act, you would think they would leave one of the clearest successes alone. They're proposing to limit the number of plans that insurers can offer, to have any willing pharmacy, which will take away some of the ability of the plans to be able to negotiate the lower plan prices.
Let's talk about that. And before I bring Avik back in, because I know he's going to want to talk about this, I hope my mother will forgive me because I love her and she's still relatively young and makes very good decisions. But that's the argument, that people say after the age of 65 or 66 have too many choices, that they get cluttered and can't make the choices that they want to make. But it sounds to me as what you're saying is that senior citizens in the nation are making their choice and making good choices and saving money.
Those who are cognitively impaired, and there are some who are cognitively impaired, will need some assistance. Many seniors who are uncomfortable using the internet, certainly not all seniors, need to rely on their children or their churches or synagogues or their aging centers for assistance. But when you have 90% of the people saying that they're happy with the program, for the relatively small percent who might need some assistance or have some problems, you don't want to take one of the most successful programs we've seen in Medicare. It's not often we get something 45% lower than expected cost. We need to celebrate that success.
So Avik, President Obama in his 2000 book, The Audacity of Hope, said, and this is a quote from the book, referring to this program, somehow it managed to combine the worst aspects of the public and private sectors, taxpayer subsidies to prescription drug companies. Is he accurate?
Well, you already recounted the astounding fiscal performance of Medicare Part D, which has been unlike any other health care entitlement in the history of not only the United States, but I think of the Western world outside of
Listen, I remember
Singapore.
As a local reporter in Cleveland, when this was first passed, we were all doing stories about how this was going to destroy Medicare and the country because we couldn't afford it. But that's not the case?
Well, I mean, it should have been paid for a little bit better. That is absolutely true. But it has come in way under projections of the cost because of the private competition element. And as Gail has ably talked about, 90% of what CMS, the Obama administration, is trying to do is going to make the program worse. In 2003 and 2002, Democrats were saying, well, Medicare Part D won't work because seniors will be too confused to choose these drug plans. 11 years have gone by. That has never been an issue. So all of a sudden, why are they bringing this up? It's quite strange.
Seems counterintuitive, actually. I mean, in a political year or in the midterm elections, to even go down this route, you're going to upset a core constituency, the seniors.
Yeah, and one thing I should mention to defend the administration on one point, 90% of what they're doing doesn't make a lot of sense. There's one thing that I actually think is reasonable, which is they're trying to create a little bit more flexibility for the plans to offer more generic drugs and less branded drugs in the formulas that they offer in these plans for Medicare Part D. That's fine. The pharmaceutical industry hates that because they want more requirements that branded drugs be used because they're more expensive. But that's actually in taxpayers' interest.
Ms. Walensky,
I agree with that. Yes, I agree with that point.
So is the administration, for lack of a better analogy, taking grandma up to the cliff but not necessarily pushing over, just expecting her to jump?
Well, I think what you're seeing is an administration that just doesn't like Medicare relying on private plans. They don't like Medicare, the Part D. They don't like Medicare Advantage, which is a private plan replacement for the price-controlled traditional Medicare. This is more an administration statement. We want to take away some of the aspects that have made this function as well as it has.
Why? I read the quote from The Audacity of Hope. Why don't they like it? It works. 45% less expensive than we were budgeting or anticipating.
It doesn't put the government in the driver's seat. It doesn't allow the government to set reimbursement rates the way they do for physicians in hospitals. Of course, many of us would say, and that's why it's 45% below projected cost. But if you believe that a government interventionist strategy is to be preferred, then you don't like seeing a private sector alternative be as successful as this one.
All right. Gail Walensky and Avik Roy.